Hi, how are ya? We know the symptoms of fibromyalgia are chronic widespread pain and fatigue, as well as stiffness, paresthesias, cognitive problems, gastrointestinal issues, tenderness in the muscles, sleep issues, headache, and more. But is fibromyalgia simply a central sensitivity disorder? I touched on orthostatic intolerance in fibro in previous videos, but I'd like to go into more detail about this dysfunction. Here we go. Our autonomic system regulates our heart rate, our blood pressure, respiration, digestion, and libido. Over the years, researchers have shown that our autonomic nervous system works abnormally. In a new study released in May of 2022, researchers found that fibromyalgia patients experience early impaired autonomic cardiovascular response to orthostatic and clinostatic challenges. This suggests that we have less flexibility and adaptability to any situational demand and the challenges that we experience. They also state that this early short-term lack of autonomic flexibility could provide a means of clinical assessment by medical professionals of fibromyalgia. Well, first, let's address what this means. Clinostatic challenges mean when lying down, and orthostatic challenges mean when standing. It's referred to as the hype phenomenon. Basically, an increase of arterial blood pressure when lying down, face upwards, and at the same time, a decrease in blood pressure when standing to receive a diagnosis of orthostatic hypotension. In the healthy population, when standing from a sitting position, gravity will pull more blood into the lower half of the body. To ensure that the sufficient amount of blood reaches the brain, the body will activate several nervous system responses. One response is the release of hormones that help to tighten the blood vessels and cause a modest increase in heart rate. This will lead to a better blood flow to the heart and brain. Once the brain is receiving enough blood and oxygen, the nervous system responses settle back to normal. But in those with hypotension or low blood pressure, the body doesn't respond efficiently, and too much blood pools to the lower half of the body. Not enough blood to the brain results in lightheadedness and often fainting, along with brain fog and fatigue. In postural orthostatic tachycardia syndrome, or POTS, the heart rate increases further and causes shakiness, forceful or skipped heartbeats, rare fainting, and chest pain. In orthostatic hypotension, low blood pressure occurs after you've been sitting or lying down, and then you go to a standing position. This results in dizziness, lightheadedness, and possibly fainting. These symptoms last for less than a few minutes. Of course, if you faint as a result, symptoms will go away after the faint, but confusion and fatigue will result. If these symptoms occur only occasionally, there's likely no concern. It may mean you're dehydrated, overheated, or have low blood sugar. So talk to your doctor, because I don't think that fainting or feeling dizzy when you stand is normal. In both of these conditions, a miscommunication between the heart and brain is occurring. This part of the fibro story doesn't seem to explain the central sensitization hypothesis that's often used to explain fibromyalgia. Dysautonomia is the overarching term used to describe autonomic cardiovascular issues. It's common in fibromyalgia. A tilt table test is commonly used to evaluate the autonomic cardiovascular function. An abnormal drop of blood pressure causes a higher rate of hypotension-induced syncope or faint, and a lower heart rate variability. And in my case, my heart stops beating for about 8 seconds and then whoop, starts up again. But they also monitor where the heart rate increases and when. So when we change our posture, alterations in body fluids and pressure should be quickly compensated in order to maintain cerebral, the brain, blood perfusion. In fibro, this is often not the case. In turn, a higher impact of the fibromyalgia disease on our daily life activities results, and more severe clinical pain is also found. When sitting, there are no clinical differences between fibro patients and the normal population. Yep, people with a certain type of orthostatic intolerance can sit and feel okay. But those with POTS may experience symptoms of lightheadedness, fainting, or rapid heart rate while they're just sitting. The experience of orthostatic intolerance includes lightheadedness and blood pressure changes when moving to a standing position. Many people with POTS also have fibromyalgia, and POTS is a form of orthostatic intolerance. The difference in POTS is the increase of heart rate called tachycardia when changing positions. It's a very disabling disease. Mainly, there are two types of dysautonomias: non-neurogenic orthostatic hypotension and neurogenic orthostatic hypotension. I'll say OH for orthostatic hypotension. You can have a temporary effect or a chronic effect, but the actual cause of these conditions is unknown. In non-neurogenic OH, a common condition in the general population, is one of the orthostatic intolerances: cardiac pump failure, low blood volume, blood pooling to the lower extremities, and some medications are the problem. Vomiting, hemorrhage, or dehydration are often the cause. This is considered an acute problem or short term. One symptom may include tachycardia and increased heart rate. People with diabetes, insipidus, adrenal insufficiency, and diarrhea will experience this on an occasion. For this video, I'm focusing on neurogenic OH. Neurogenic OH is considered rare in the general population, caused by an underlying neurologic disorder that affects a specific part of the autonomic nervous system. It's an orthostatic intolerance because of the characteristic symptoms while standing and improved symptoms when sitting or lying down. It's often caused by hot weather, a hot shower or bath, or a hot tub. The terms used are neurally mediated syncope, neurocardiogenic syncope, vasovagal syncope, and others, and includes POTS. A tilt table test is often used to diagnose, but may begin with other tests first to rule out other conditions. A tilt table test checks the autonomic reflex and determines if the condition is neurogenic or not. About 50 to 97% of people with chronic fatigue syndrome, called ME/CFS, have orthostatic intolerance. It's also common in fibromyalgia, with 65% of people with fibro having a positive tilt table test of a dysautonomia, and about 44% of fibro patients experiencing syncope or fainting. A 1997 study by found an abnormal drop in blood pressure in those with fibro when given a tilt table test. This began the process of looking at this phenomenon. That same year, Martinez-Lavin hypothesized that there is a sympathetic nervous system dysregulation in fibro. This study validated the sympathetic nervous system hyperactivity in fibromyalgia. And then in 1999, this same researcher stated that the lupus-like symptoms in fibro might be the result of autonomic nervous system problems. Many studies followed, one in which a cold pressor stress test, where they plunged the hand into icy water, was used and found a lot of cardiovascular factors were reduced in fibromyalgia, even at rest. This is often shown that when fibro patients are under stress, the autonomic nervous system, the ANS, fails to respond properly. The ANS appears to be turned on all the time, causing exhaustion and collapse during stress. The problems with blood pressure were associated with more pain sensitivity. And then to make matters worse, the inability to exercise was shown in these studies. We have an inability to increase the heart rate during exercise. The ANS is also believed to cause other issues like sleep disorders, chronic pain, allodynia, anxiety, pseudo-Raynaud's phenomenon, Zika syndrome, and intestinal irritability, among others. I believe that I was diagnosed with neurocardiogenic syncope just prior to my fibromyalgia diagnosis, but I've kind of forgotten. I'll have to look at my paperwork to be sure exactly. I just remember them being very closely diagnosed at the same time. So, do not rise from a sitting position too quickly. Rise slowly from your bed to a sitting position and stay there for a few minutes before you rise. Certain medications are used to increase blood pressure. You should avoid long walks in hot weather or working in hot weather. Avoid hot baths. Ugh, I love my hot baths, but I'm careful not to make them too hot. Limit alcohol use. Elevate the head of your bed. Could help. Avoid large carbohydrate type meals. Do resistant exercises to improve your leg strength. And you can do those while you're sitting. Elevate your salt intake in some cases. You can try electrolyte drinks or put a little salt in your water to drink on occasion. But there are some physicians who don't recommend that. They recommend you to decrease your salt intake. And that's confusing to me. Or drink 2 8-ounce glasses of water rapidly to expand your blood volume. Sometimes doctors may ask you to wear fitted elastic stockings or medical compression garments with your stockings, or sometimes alone. Midodrine is a medication approved by the FDA for autonomic issues. Midodrine worked well for me. I had to take it when I was getting allergy shots, but I started with atenolol, a beta blocker, and you can't take a beta blocker while you're getting allergy shots. I'm back on atenolol now, but another medication is fludrocortisone. It's a corticosteroid. It's used in postural hypotension and adrenal insufficiency. In adrenal insufficiency, not to be confused with adrenal fatigue, it's generally taken with hydrocortisone. But if you're taking estrogen or have an underactive thyroid gland, have diabetes, have had heart disease, or other conditions, this may not be the medication for you. Talk to your doctor. Another medication is called droxidopa. It's used to treat neurogenic OH. In some people, caffeine is used in treating neurogenic OH. I found that my symptoms have increased since going off caffeine. So I'm rethinking that decision. And then my husband recently bought me half-calf coffee. I've got more energy, and I'm able to move around better with less dizziness. I have a lot of problems with balance and lightheadedness, dizziness, and if coffee, even half-calf, helps with that, I'm drinking it. What do you think? Am I crazy? If I'm not losing my balance as often because of lightheadedness and banging into walls and doorways, it seems worth it to drink some coffee. I was on medication during all of the situations I'm about to explain. I didn't faint because of the medication, but other symptoms still plagued me. When we were on vacation in Colorado, that high altitude caused me to feel weak and fatigued and lightheaded. I had to lay down for an hour after being up in the mountains just to recover. Another time we went to Arkansas, passing through as we headed to Texas, and we stopped at the Crater of Diamonds State Park to dig for diamonds. It was so hot, like 114-degree heat index. It was August. Crazy time to go, but we were taking our son to school he was attending in Texas. I started the process of diamond hunting, and within minutes, I ended up on my back to relieve my symptoms. I got help to the bench. Thankfully, they had benches under an outdoor structure. My husband and our youngest son continued to mine for diamonds. I was so miserable. I put my legs up in the air onto one of the beams. Can you imagine? With all these people around, I'm laying on my back with my legs up in the air. I was so embarrassed, but really I didn't care because I was so dizzy that I had to keep my eyes closed. So who knows how many people were looking at me like, what is she doing? After the graduation ceremony, we all walked outside and stood around talking. I felt the effects of that horrible Texas heat immediately. So I started looking around. Is anybody else experiencing what I'm experiencing? No one else looked in distress. They were talking normally. And finally, I told my husband that we have to get me in the car into that air conditioning. And he and our son walked me back to the car. I took a look at myself in the mirror and my face was beet red. I said, why didn't you tell me? Oh my. I mean, he didn't look like that. My son didn't look like that. I don't think I was really sweating, although excessive sweating can be an issue with this condition, but that's not always the case for me. I wish that I had had a folding cane with a seat attached to it. And there's also folding chairs that aren't canes, but a cane with a seat seems like it's easier, in my opinion, to carry around. I put a link to one of these in the description section, or maybe you already use one when you go out. But if I go south again, I will have one of these handy, just in case. Pride comes before the fall, they say. I can't be prideful and not practice taking care of myself. So I hope you learned something. I think I have more to share on this topic. So hopefully this is something you're interested in. Please let me know in the comment section. I send you gentle hugs and support. Love you. About this discipline. This will lead to a better along with brain fog. In postural orthostatic I'm used to explain the central sensitivity. Oh my Lord. This part of fibro. Yeah, people with even or heart. Oh wait. Adrenal incept. Neurogenic OH is considered. I heard that. Caused by an underlying. Are you done? A tilt table test. It's also common it's simply meant to make matters more with the stockings or fitted a less. But another medication is Pluto and a crack and hanging and after the graduation ceremony.